It's important to understand the MAKO technology, I think, for patients, as like most technologies, it's something new that is an instrument that helps us to do the surgery in a different way than we used to. I liken it to a GPS system in your car. Before we had GPS systems, you drove your car, you had to figure out where you were going using a map, you had to pay attention to the road and where you were. And the MAKO is an instrument that acts more like a GPS system in your car does. It helps me get from point A to point B in a more precise and predictable way. And so it also has the ability to help me do the surgery itself. So not only can it help me understand before I do the surgery where I'm starting and where I want to go, and in this case it's taking a knee or a hip that has bad arthritis and wear and tear and putting new parts in there in a place that is going to help the body know where they are. But it also helps me implement that plan. So it's not quite autopilot, it doesn't drive the car, I still do the surgery, but I use this tool to help me do the surgery in a more accurate way, using this robotic machine to put the parts in a more predictable way. I do think there is a component of making the surgery less invasive because it is more precise and now in my hands has become more predictable. I think that I can do the surgeries with less pulling on the tissues, and I think some of that's been documented. So the advantages to me and the reason I have adopted this technology is because it allows me to do three things. One, plan the surgeries more precisely using a CT scan or other imaging tool. Two, to make adjustments during the surgery for each patient specifically. With the technology, you can make adjustments for each patient. And then three, put the parts in where we want to put them. So once I figure out where it's going to be for that patient, the machine helps me to put the parts exactly where we plan so we don't get any changes. And I think those are the real strengths of the technology.